So today is actually a bonus session, and thanks to viewers like you, and thanks for questions and contribution that people were still inquiring about heart health. So I'm happy to do, I think this is part 8 now. So part 8 of the Applying the Wisdom of Chinese Medicine series, and I'm happy to do this bonus one. So again, welcome everyone, and thank you for joining me. And I've really enjoyed actually the past, I can't believe it's been 8 weeks already, and it's actually flown by, for me it's flown by quite fast. And so this, actually the past 2 weeks were sort of my bonus ones, and last week we talked about gut health. This week we're talking about heart health. And yes, thanks for all you viewers asking some wonderful questions, emailing me. And again, please comment, live if you have a specific question. So again, my name is Dr. Jeffrey Lee, and I'm both a naturopathic doctor as well as a registered acupuncturist. And we are going to be talking about heart health today from a Chinese medicine perspective. And the 3 topics that I'm going to be covering are stress and joy. Okay, so that's topic 1. We're going to talk about the Hawthorn Berry. That's number 2. And then number 3, we're going to integrate some movement. We're going to talk about some cardiovascular exercise for heart health. And if you do enjoy these videos, please continue to share it with your family and your friends, and please give it a thumbs up. So before I launch into this topic, I just want to remind everyone that we are still doing the Brio Bingo, and I'll put a link at the end of this this Facebook Live for you can download the sheet and just join us. There's still almost a month left for our Brio Bingo, and it's just a fun thing that we can just all do together as a community, just to encourage each other to be healthy during this time. And it's fun to do it with your family, and so I just want to remind everyone to consider doing that. And you have till June 21st, and I think that's Father's Day. So if you haven't gotten started, check it out, take a look at that. Okay, what did we talk about last week? We talked about boosting gut health, and we talked about how the stomach and the spleen meridian is all connected to worry and anxiety, and even the tips enjoying warmer foods rather than the cold foods, and that's really important for the spleen and the stomach. We talked a little bit about the microbiome, and I've got some good questions from the microbiome, and actually all week I've been talking to a lot of patients virtually about the microbiome. And and I might take a bit of a deeper dive into the microbiome, depending on your feedback out there. And last week we also talked about a couple of herbs there, just to again strengthen the digestive process. We talked about mint, enjoying some mint after a meal, and we also talked about a bitter herb called gentian, and both those are very impactful for the bile, to release some bile to aid in digestion there. Okay, that was a recap from last week. And like always, I like to start off the series just asking a number of questions. So I'm going to ask you 5 questions. It's sort of my heart health assessment. And ponder these questions. So, if you say yes to any of these, perhaps this is today's talk is going to be valuable for you to improve heart health. So question number 1, do you have any pain or any discomfort in your chest or your left arm? Do you have any dizzy spells? Number 3, do you experience swelling in your ankle, in your feet, in your legs, or any swelling in your abdominal area? Do you have high blood pressure? And then number 5 is, are you a diabetic or are you overweight? Again, all those are, depending on how you answered, but if you answered yes, that can really impact your heart health there. So my question is this: why is heart disease less of a problem in places like rural China, rural Brazil, parts of Africa? And why is heart disease still such a big problem in these Western societies? And I've been practiced for about 15 years, but my medical career started 20 plus years ago, and I remember back then in the late 90s where heart disease was the number one killer and of people, and heart disease was totally on the rise. And if you were to ask me back then, in 20 years, in 2020, would heart disease still be a problem? I would have honestly answered no back then, because we know what causes heart disease, yet we aren't changing a lot of our behaviors, and heart disease is still, I don't think it's number one right now, but it's still up there in a lot of premature deaths, in my opinion. So we know that a standard Western diet, with a lot of like the sugars, the poor fats there, the processed foods, we know that's contributing to heart disease. We know that stress is contributing to heart disease. And we know that a sedentary lifestyle, lack of exercise, we know that's contributing to heart disease. But with our modern day kind of studies and what we're discovering, I'd like to add a few other things that I think is also contributing to heart disease. And ultimately, keeping this a top issue in causing deaths in North America. I'd like to suggest the microbiome is a potential cause of our heart disease. And what I mean by the microbiome, I went into a lot more detail last week, but the whole ecology, the whole balance in our bodies, but also in our environment, that is so out of balance these days. And I think because of this imbalance, because of just the pesticides, because we're not in our poor quality of farming and all that, we are eating foods that are just not as vibrant, not as healthy as that it should be. And I think that is contributing to my next point, which is metabolic syndrome. And if you haven't heard of metabolic syndrome, this is very well researched in modern Western medicine. Metabolic syndrome is that combination of diabetes, fatty liver, elevated cholesterol, obesity. All of that packaged together, we're calling it metabolic syndrome, because that is contributing to a lot of problems in the body, and especially in heart disease. And the third thing I'd like to add is the toxicity. The toxicity in our environment is on the rise, and a bunch of us just finished this group detox that we did collectively as a clinic, and how the feedback that I've gotten from many of you is just incredible. Like you feel so much better when you can get rid of some of these toxins out of your system, and so I just wanted to add in a few things that I think is really contributing to the heart disease, in 2020. Now, I just wanted to also mention, I think it was just yesterday that I watched on Netflix, there's I think a new documentary that just came out. It's called History 101. And I just watched the fast food, the session on fast foods. And it was just really interesting how it walked us through the journey of how, how fast food came to be so popular in North America, and how it spread around the world. And then at the same time, they showed that how obesity was just kind of in step with the fast food industry. So interesting. I just wanted to just share that with you. If you have the chance to just check out that Netflix documentary called History 101. Okay, now let's talk more about heart health in TCM. So heart health in TCM. I've talked about this several in several of the weeks there, but Chinese medicine puts a lot of emphasis on blood, and not just the blood circulation. So blood circulation is very important, but Chinese medicine talks a lot about the quality of the blood. So blood brings nutrients, it brings oxygen to all parts of the body, and it's the heart that physically pumps the blood all throughout the body. the blood also gets rid of a lot of the toxic waste in the body. Gets rid of just the CO2, for example, after metabolism and respiration there. And another important concept in Chinese medicine is anytime there's a disease process, like a pain or any kind of problems, we call it a blockage or a stagnation. Chinese medicine says that circulation is no longer there, or it's restricted there. And another concept that I've talked about, especially I think 2 or 3 weeks ago, we were talking about the boosting the brain power talk. I talked a lot about the mind and how the heart houses the mind. And I'm going to go into a little bit more detail right now because to me this is fascinating, and I love studying this. The heart houses what we call the Shen. And Shen, it's a difficult concept to translate, but it's referred to as the spirit or the soul. And the Shen also encompasses the mind. So when you have good Shen, you've got good mental activity, you've got good consciousness, you've got great mental focus, planning is not a problem, great intelligence, they say, you've got great thoughts and ideas, and all that is the manifestation of Shen. And I've had the privilege of working with so many different types of patients there, and I have seen when the Shen is lacking from an individual. And this is when you see that lackluster in the eyes. And because in Chinese medicine, it teaches that the heart energy opens up into the eyes. So you can really get a glimpse of a person through the eyes there. And I'll give you an idea what I mean by sort of this lackluster or this dull appearance with the eyes. I remember working with several kids, especially kids with disabilities. And I mean, this was years ago when we were starting to see sort of the onset of autism. And you could recognize that it was very difficult for some of these kids to make eye contact. I would even hold their heads a certain way and have them sort of track my movement, and they had a lot of difficulty doing that. And I've also had the privilege of working with some people that went through significant traumas in their life. And that significant trauma really impacted them psychologically. And you could really see that they just, they had this blank stare, and it's just as if they just weren't present. So that's, I hope that was a good explanation of, what Chinese medicine considers kind of the heart energy and what that Shen is. So I also want to just talk about, or actually, this is a good time to also talk about how important it is to balance the heart energy. And I do this a lot in my practice with acupuncture. And I find acupuncture is such a remarkable way of just tapping into the system and calming and resting the mind. Because what I see in my practice when the heart energy is really stirred up, this is where I see some of my stressed out busy executives or stressed out busy moms that come into my practice. You can tell that the anxiety, you can tell that stressed energy, it really disturbs the mind, and they end up getting disturbed sleep. They can't really focus. They can't really kind of calm themselves. They can't really rest there. So acupuncture is a great way of just calming Shen, balancing the nervous system ultimately, and that's something that I do work a lot in my practice. And I just also want to kind of draw some unusual connections to other ways when I see the heart energy really out of balance is sometimes I'll see people with just unexplained itching all over their bodies. And it could be, tied into maybe a previous eczema or, some kind of dermatitis. Or recently, especially the past 4 or 5 years, I'm just seeing people with unexplained hives. They're not sure if it's a autoimmune condition. They're not sure if it's a viral issue, but using acupuncture to balance the heart meridian has been able to treat unusual cases of itching. I've also been able to balance the heart meridian, and that's helped by treating back pain. And there's a very interesting kind of connection in Chinese medicine between the heart meridian and the kidney meridian. And the kidney meridian is always well known for the weak kidney energy causes a lot of back pain or weak knees there. I also balance the heart meridian when I'm treating men, especially men with any type of sexual function issues there. And that can range from erectile dysfunction to premature ejaculation. So balancing the heart meridian can also, in men, balance the sexual organs there. And then definitely balancing the heart meridian. I've helped a lot of patients with urinary problems, and this could be like frequent urination at nighttime or just that overactive bladder. So those are kind of unusual. We don't hear that much. We don't hear that talked about much at all in a Western perspective. But in Chinese medicine, the heart meridian is a real. It's really that ruler, that governor with all the other organs. It really kind of pumps that blood to keep things going. Okay, now let's talk a little bit about just heart healthy things to that you can add to your lifestyle. Number one, I want to talk about stress and joy. So the emotion that is tied into the heart is joy, and when we want to nourish our hearts, we really have to bring this emotion more into our lifestyle. And like I said earlier, I treat a lot of people that are totally stressed out. And one of my antidotes to stress is to really guide people at finding more joy in their life. So again, when that heart energy is disturbed, I mentioned earlier, you see things like the insomnia, the disturbed sleep, the frequent waking, or issues around poor memory, or they can't really focus, or they can't think clearly. So keep that in mind, because if you're experiencing that, a lot of that could be your heart meridian is a bit congested, things aren't flowing. So again, to remedy that, find ways of experiencing joy. And to me, one of the best ways is through social contact, through friendships, through community. But you can also find ways of experiencing joy through dance, through music, through hobbies, things that you really enjoy doing. And another recommendation is learn how to express your emotions. And I think this is difficult for a lot of us in North America to really feel comfortable expressing our emotions. So my recommendation here is develop that skill set to understand your emotions. And for those of you listening, I'm actually going to be doing a master class this coming Saturday, and it's part of my other series that I'm talking about improving the nervous system, improving brain health. And I'm walking through that Brio journey where we go from weeding, seeding, feeding, and thriving. And we're on the feeding section right now. And what I plan to do is share with you some of the things that I do with my patients to talk a little bit more about this mental emotional stuckness. And so I invite you to come in and take a listen, and I'll go into more detail about some of the things I do with my patients. And right now, one of the things I do in this topic of helping people express more emotions, I liked, recently I've been having some of my patients do different personality tests, and or doing something called a Strengths Finder, and in doing so, filling a survey out or answering a bunch of questions, we get to explore a little bit more. It's like, is that congruent to what you feel that you are? This type of personality type, do you agree with this survey? Do you agree with this assessment? And that's one way, one of many ways. You could be reading books on emotions, on that. But I find that this is a very interactive way of doing it. So I'm going to dive into that a little bit deeper during my masterclass. So if you're interested, please join me. So that's the stress and joy. So find ways of cutting down stress, find ways of improving more or adding more joy to your life. Okay. Number two, we're going to be talking about the Hawthorn Berry. And when I mention this to patients, I think a lot of people are familiar with Hawthorn Berry. They've heard that it is a wonderful cardiovascular tonic. And I think a lot of Western medicine actually is familiar with Hawthorn Berry. And historically in Chinese medicine, Hawthorn Berry is used to clean the blood. It's to clean the blood from plaques and other toxins there. Hawthorn Berry is known to maintain healthy cholesterol and also to lower blood pressure. And it also is very rich in a lot of antioxidants and things like proanthocyanidin. And these are both anti-inflammatory and they're anti-clotting. So the Hawthorn Berry actually has a lot of just amazing properties to improve blood. And I wasn't originally going to talk about this, but I just want to add a little bit more about, in Chinese medicine, other things that just promote blood and improve the circulation. The color for the heart is red. So a lot of the foods that are red in color, that has this the red pigment, this antioxidant, is also very anti-inflammatory, and it could be anti-clotting. So things that come to my mind are like, red lentils, watermelon, peppers, red peppers, or even chili peppers. Those are some, like red dates, goji berries. Those are things that are in Chinese medicine very important at tonifying the blood and supporting the heart there. So I just wanted to touch on that for especially Hawthorn Berry, and I just thought about some of these red color foods that are also very nutritious. Number three, the third thing I want to talk about is movement and heart health. And you probably hear the word cardio all the time. And I know a lot of my patients have asked me over the years, well, what does cardio mean? And it's very simply, it's just cardiovascular exercise. So a lot of people just kind of drop the end of it and they just call it cardio. And this is something that I truly believe that the both types of exercise where you're doing a lot of resistance training as well as cardiovascular, that combination is really, really important. And I often call that yin and yang and getting that type of exercise balanced out. But let me talk a little bit about cardiovascular, because this actually involves a little bit more exertion. And the benefits of cardiovascular are things like it speeds up metabolism, it really burns excess calories, and it really regulates blood pressure, because that movement causes the heart to pump a little bit quicker, gets more blood circulating. And things that I enjoy doing for cardiovascular exercises, very simply like a brisk walk. Body weight exercises, calisthenics, those are great at getting the cardiovascular going as well. Swimming, cycling. And I'm recommending a lot of these are just very low impact types of activities. And what I've observed in my practice, if I can have patients commit to 20 to 30 minutes a day of some kind of cardiovascular activity about 4 times a week, I find that there's so much benefit to that. So I hope those are very simple, and that's the whole idea of the series, just finding simple things that you can do, that you can apply in your everyday life there. And I just want, again, just to finish off this section, just to touch base on a little bit of that, what I said of the yin and yang movement there. Um, the yang movements are just faster movements, like the cardiovascular. And in a previous week, I talked about high intensity exercise that can really boost up something called BDNF, brain derived neurotrophic factor. Excellent for the brain, but also excellent for heart health as well. And then the yin, the more slower movement, we're tying in things like the Tai Chi and even, just stretching. Movement like that, that's also very good at just improving circulation. So I hope those tips were helpful there. And again, please share all of these Facebook Lives, these videos to family and friends. And this actually is going to be concluding my originally a 6-part series, but we've changed it to an 8-part series. And I welcome you to revisit some of those topics there. On our website, we have I'm creating sort of a journal for people to answer some of those questions there. So do enjoy that. I see. Is there a BPM goal regarding cardio? So is there a kind of a sort of a blood am I understanding that correctly? If you can just clarify that. Is that like a BPM? Just describe that, because there's a couple of different definitions for that. And I'll wait for your kind of description there. I think in terms of maybe what the rate in terms of exercises, that's where I do kind of customize it for certain individuals. I'm still waiting for this person to clarify. I got you. Okay, so more of kind of heartbeats per minute there. Excellent. That is a great question there. It is something that actually I'm going to take a very quick tangent, because I think that's an awesome question. Our newer studies these days, we're moving a little bit away from sort of a heartbeats per minute type of approach. Now, a lot of very cool tools out there are measuring things like heart rate variability. Rather than just the simple beats per minute, or even blood pressure, we're finding like a lot of the new science is looking into heart rate variability, how the whole nervous system actually interacts with heart health. And so I think that's a brilliant question there, but I'm going to invite you to just maybe look into the heart rate variability a little bit more. The past couple of months, I just picked up this, I think it's called Core Sense, but it's a super simple device, because 10 years ago when I was going to buy a huge heart rate variability machine, it was like $10,000, and you can strap it around the chest, and I was heading in that direction for testing the heart. But with the more modern day research, being able to measure, of course, like a finger measurement for heart rate variability is not as accurate maybe as a machine, but it's still pretty darn amazing right now, just the amount of research that I'm looking into. So I would actually point you to that direction, because to answer the beats per minute, I really do customize it for an individual. If some of my patients are a little bit more on the obese side, I don't want to put too much stress on their heart. And in fact, if their heart rate variability is pretty good, pretty intact, that's when I might push them a little bit more. So with some newer science, newer technology, I think that's a great way of measuring how much your heart can handle there. Those are awesome questions. Are there other questions that I can answer? I just had a little tickle in my throat there. It doesn't look like I'm getting any other questions there. But let's keep the conversation going. If you think of something else, please put that into the comments there, and I would love to keep engaging with you. And also, if there's specific topics that you want us to talk about, I'm still thinking about the next series, and we're going to have a big kind of clinic-wide meeting on as we're slowly kind of getting back to reopening up the clinic sometime in June and starting to serve patients. We're going to try to find a strategy where we can continue to share relevant content to everyone here. And also manage the busyness at the clinic. So please let us know, other topics that are of interest for you. And I always enjoy interacting with all of you. Thank you for your participation. And I wish you, I wish you a lot of good health and safety. See you soon.